Okay, so let's look at some neuroanatomically based targets for deep brain stimulation in Parkinson's disease. These are areas of the brain that, when stimulated electronically with an implanted electrode, have improved the symptoms in patients with advanced Parkinson's disease. There are four main targets: the globus pallidus internus, the subthalamic nucleus, the ventro-intermediate nucleus of the thalamus, the pedunculopontine nucleus. All have been shown to effectively reduce the signs and symptoms of Parkinson's disease when electrically stimulated. So the big question is, why do we care about this? Well, of the four targets of deep brain stimulation, 3 out of the 4 may be able to be modulated non-invasively with different types of stimulation. For example, the subthalamic nucleus has connections from the dorsal columns in the trigeminal spinal nucleus, which in theory suggests that transspinal direct current stimulation may be an effective way to indirectly stimulate this ganglion, or tongue stimulation through cranial nerve 5. The VIM and the PPN both receive strong inputs from the vestibular system, which suggests that external vestibular stimulation may modulate these nuclei. This is the operational premise we use in our office when using non-invasive neuromodulation techniques with our Parkinson's patients. As you'll see on videos, the patients seem to respond. Do we know for sure that we're stimulating these deep brain targets and that that's the mechanism of the observed improvement? No, we don't. That's our theory of biological plausibility.
Well, it all started out, I got up one morning and after I turned 80, and I went to get up and I couldn't move my leg, left leg. So then it just continually got worse and worse and I couldn't walk.
Have you had any other treatments or medications or anything for it?
Well, dopamine, they give me, I forget the name of the stuff, it's called dopamine. And I don't know if it helps or not, but I can't notice the difference.
Okay.
But when we read this article about the doctor, we decided we'd try that. We'd try anything, you know. And it worked wonderful yesterday, so.
Now tell me what happened yesterday, if you will.
Okay. I came in and the doctor said he thought, I told him, I said, you know, I need somebody that can cure me. He said, well, I'm going to try. So he put these headsets that are on, you know, bone connectors. And he said, follow me. And I thought, yeah, sure. And I got up and walked. I followed him. It was just amazing. I don't know how you could feel any better about anything. Do you, Carol?
No.
What was going through your mind at that moment, Frank?
I don't know how to explain it. Just joy.
Relief.
Relief, yeah.
And how long have you not been able to walk?
Since about September.
October, really?
September, October. It just came on one morning, I got up and couldn't move my left leg.
And
Instantly.
we weren't sure what was the problem, so we went to a neurologist.
Dr. Mercer, and we took all the scans and everything, and he came up with, he said, you've got mild Parkinson's. So I don't know what mild and heavy is, but I had never heard of just a foot being Parkinson's. A couple of friends of mine have had the hand shaking, but
It only affected Frank and just
in
his
my
left leg.
And I'll be walking along, it'll just stop, and I want to keep going forward, and I'll fall. I fell 3 or 4 times. So.
And he's very afraid of falling.
Of course, yes.
And I'm afraid of him to fall because
Yes.
if he hit his head, he could end up with a concussion or, severe brain injury.
Of course. Frank, is there anything I missed that you'd like to add?
No, I just thought the doctor did wonders yesterday because when he said get up and follow me, I thought, yeah, sure. But I did. I'll wait to hear.
Wonderful.
Yeah.
Yeah.
Whenever you're ready.
Just about as fast as I can go without falling. Left froze now. It don't want to move.
See, you can see he's trying.
It's so strange that just the left leg would just freeze. It don't want to move anywhere.
There it goes.
There it goes.
Sometimes he said to point your finger.
No, it don't work.
It doesn't work.
No. Another lady was walking the other day. She said, "You want to wear a race?" I said, "You'll win. Don't worry."
Frank.
It's really like a miracle that I can walk.
Is that better? Move your arms.
Makes me want to move faster.
Frank, what's going through your mind right now? How are you feeling, Frank?
It's like a miracle.
Good.